Hey, welcome back. We're here with Dr. Peter Yu, who is the owner, operator, and main dentist at The Tooth Doctor. So tell me, Peter, you have 2 different locations in Edmonton. Is that correct?
No, actually, that's incorrect. Sorry, in Edmonton. Sorry.
In Edmonton.
Yes, in Edmonton, I do have 2 locations.
All right.
But we do have another 3rd location out east of Edmonton.
East of Edmonton, out in Tofield.
Yes.
So the first one that you opened, where is it located?
We are located in Capilano.
Okay.
Just south of the Wayne Gretzky. We're kind of in the Forest Heights, Terrace Heights area, kind of close to Ottewell and Holyrood, that area. Yes.
Okay, nice. Now, in your office, like earlier when we were discussing our topics today, let's talk about the CDCP. So what does that stand for?
What is that? Canadian Dental Care Plan?
Canadian Dental Care Plan. And so how do people, do you guys offer that in your office? Do you support it?
We do accept it.
Okay.
Yes.
All right.
So the federal government has put a plan up there to basically provide support, basically subsidize for a lot of Canadians that are making certain below a certain wage.
Mm-hmm.
Yes. So the dental plan does help for like your basic dental care, checkups, your cleanings, x-rays, fillings, root canals. And we've had some patients where they were in a tricky situation with a crown, and a crown can be quite expensive. And we've been fortunate to have some patients where under certain circumstances that their crowns were subsidized. So a good portion of their crowns were covered for them.
Okay. So getting involved or getting started with that CDCP, what are some of the first steps that a patient has to do in order to take advantage of that program?
So there is an application form, like all things. Like there's government funded stuff. And so if they have any questions, they can talk to our receptionist. I do want patients to be aware that the CDCP, it's because it's run by the federal government. It doesn't always follow exactly what every provincial jurisdiction is, right? So, BC, Alberta, Saskatchewan, Ontario, Manitoba, all the different provinces, they'll have different fee guides.
Okay.
And so please be aware that, the federal government, the CDCP, does fund quite a bit of each procedure. But there will be a tendency for certain procedures where there'll be a nominal cost, right? So, we had a patient that came in and they thought it was 100%. And we're like, I'm sorry that it's not fully 100%. They're like, oh. But then when they had done their procedure and came out, their portion was $21.
Gotcha.
So it's not that much.
Right.
So, yeah.
Okay. So the CDCP program is not 100% free. It's not 100% coverage, fully covered by the government. There still may be some out-of-pocket costs, like with any insurance product, right? Now, do you continue to follow the same fee guide that you do normally for your patients?
We just follow the Alberta fee guide. We feel like it's, being fair to one person and the other. That's the best and even keel way to have our fees so that it's beneficial for all Albertans.
Yeah. Well, it makes it more fair and easier for you to administer, right? So you don't have one price for the CDCP and another price for everybody else.
Yeah.
Yeah. That makes a lot of sense.
I'll mention for the CDCP, I believe they do not allow you to have CDCP if you have another insurance. So if you have, health insurance from your company or you have personal insurance, then unfortunately you cannot receive it. But it's meant for people that have basically no insurance and have a certain wage. Now, there are patients that have, I believe, government assistance. So we do have some seniors where it's they have seniors benefits and they have CDCP. And so that's been helpful in terms of having kind of a, so to speak, dual coverage. So.
Okay. No, that makes a lot of sense because if you already have insurance, of course, they want you to use that first.
Yes.
And it's really for people who have, they struggle with, affordability for dental work.
Yes.
That's what it's for. Great. So if you are in the Edmonton area, so you're in Ottewell, Holyrood, Fulton Place, Capilano area, right in Edmonton there, that's where the main tooth doctor location is. You can go there. They accept and support the CDCP. And also your other location in Edmonton is down, we call it Ellerslie, but the different neighborhoods that are around there, if you are anywhere in. So if you're in Blackburn, Richford, Blackmud Creek, MacEwan, Rutherford, Callaghan, Allard, any of those areas, that's where you can go to the tooth doctor. They have another location conveniently located just off the Henday and Ellerslie Road. You can make an appointment there. Go to thetoothDoctor.ca and you can easily set up an appointment there by calling in, or you can do it by email. Thank you so much, Peter, for sharing all that information about the Canadian Dental Care Plan, and I hope that was informative for you. Thanks a lot. See you on the next video.